Good morning, parents. My name is Cherrick Gordon. We are live. A quick welcome. I'm Cherrick Gordon. I'm a pediatric physical therapist, and I show parents just like you around the world how to use simple touch and movement to help their babies get stronger and smarter. In today's live Q&A, we're going to be answering questions about how to prevent positional plagiocephaly or flathead syndrome. Now, flathead just is exactly what it sounds like. It means that your baby has a flat spot on one side or on the back of their head. Now, if this is your situation and you're looking to figure out how to be able to correct it or prevent it, then you're in the right place watching the right video. Now, a lot of times parents ask me, what causes positional plagiocephaly or flathead syndrome? And so flathead occurs when your baby spends a lot of time on their back or with their head turned to one side on the side of their head. And so it develops a bit of a flat spot on that spot that they like to sleep on. And I did some research, and a lot of babies are actually born with some sort of a head deformation where the vaginal canal might be a little bit too narrow. During the birthing process, the head becomes a little bit distorted. And so a lot of babies are actually born that way. So you're not doing anything. You haven't done anything wrong. You didn't do anything wrong, or you're not doing anything wrong. And your baby could still actually have a flat head. Now, a study was conducted where they looked at the amount of magnesium in the baby system, and they found the babies who had low magnesium, and parents, mothers who had low magnesium, that their baby's bones and actually the skull was a little bit softer, and so they were more prone to be born with a little bit of a flat head from the very beginning. Now, if your baby is laying in their crib and they have a favorite toy that they like to look at on one side of the crib, the baby will turn their head towards that side, and that can definitely cause a flathead syndrome to occur over time. If you put your baby in bed at the same time in the same position, with their head in the same position, then your baby will turn their head towards that side, and baby will develop a bit of a flat spot because they're looking at this TV or they're looking at the same toy in that position over and over and over and over again. Now, I did a full video about this some time ago, and of course, this is it here, and I'll drop the link in the show notes, where I did a deep dive into positional plagiocephaly and flathead, how to prevent it. Now, it's important that you keep in mind that there are things that you can do to help to correct this. So one of the first things that I like to tell parents to do is to simply reposition your baby each night. So if you put your baby in bed with baby's head at the head of the bed one night, the next night, flip your baby in the opposite direction. Why does this help, and how does this even work? Well, this helps because your baby is going to rotate their head to look at their favorite toy, which is probably going to be fixed in one position, or to turn their head to look at the television, which is going to be fixed in the same position. And so you can do that. And if you flipping baby from one side, from the head of the bed to the foot of the bed, now baby will have to turn their head. And so you'll have a nice round shape in the back of baby's head. Another technique that you can use is lots and lots of tummy time. By putting baby in tummy time, you can take the pressure off of the back of baby's head completely and simply have your baby doing tummy time, and also getting the additional benefits of tummy time, things like strengthening the arms, strengthening the chest, the shoulder muscles, increasing that core trunk strength, which is super important for a baby. So that's another tip that you can use to prevent the flat head. Another technique that I like and I advocate for and tell all the parents that I work with to use is to buy a baby carrier and put your baby to sit in the baby carrier and carry your baby around. Now, carrying your baby around has a whole host of additional benefits, and I did a video about that where I talked about the benefits of baby wearing and how to wear your baby. but we're talking about flathead syndrome. So now this takes your baby's entire body off the ground, and your baby is in this harness close to you. Baby has to hold their head up, look around from side to side. And so this allows baby to develop neck strength and head control and be able to better rotate their head from side to side. And so this is a great way to prevent flathead syndrome and to also strengthen your baby's neck at the same time. So these are some really great techniques that you can use to prevent flathead syndrome. Now, a couple of things. I had a question from one of my videos where a woman asked if she could correct flathead syndrome because her baby is 2 years, 8 months. And she asked me, can she still correct her baby's flathead, or is it too late for her to be able to correct her baby's flathead? And the answer to that is, it is a bit too late to correct flathead. Now, why do I say it's too late? Because we need to take a step back. When a baby is first born, the bones in their skull are actually soft and malleable. I'm going to show you a website that talks a little bit about that. The bones in their skull are soft, the bones are malleable, and let's see. So according to the website, the optimal time for treating a flat spot conservatively is within the first 4 months. Due to the way this is corrected, once your baby starts rolling, it becomes more difficult to treat. And so it's important to recognize the flat spot early and start treating it early. So the question was, at what age a woman wanted to know. She had a baby and her baby was 2 years, 8 months old, and she wanted to figure out, can she still correct her baby's flat head? So in order to look at something like that, what you want to do is go back and take a look at what age your baby's bones start to harden, what age the sutures in your baby's skull begin to fuse together, and figure out if the bones are still malleable and flexible enough to be able to correct the flat head. So here's the thing. The optimal age to correct the flat head is very early, before the first 4 months. This is if you're trying to just use simple positioning. Now, if beyond 4 months and your baby's head is still flat, then you may need to employ the use of a helmet. And there are companies that make these helmets. But at around the 2-year mark, all the bones in your baby's skull will fuse together, and your baby will not be able to correct the flat head anymore beyond the 2-year mark. And so it's very important that if you see something and you want to take action, to go ahead and do that quickly rather than hoping that it will correct itself and waiting and waiting, and eventually you realize you've waited too late and that it can't be corrected anymore. And now your baby has this head deformation that they have to live with for the rest of their life. All right, my friends, that's it for today. If you found value in this live Q&A, then go ahead and drop a like or ask a question. Also, if you are interested, you can follow the BabyMasterPT channel and share it with your friends and family so that they too and other parents can benefit from the tips and tricks that I share on this channel. Thank you, and I'll see you tomorrow.